Okay, called for a motorcycle down on a busy 4-lane highway on a warm, dry summer evening. PD and fire have the scene secured and access is safe for EMS. Patient was not wearing a helmet. Patient is approximately 30 feet from the motorcycle.
Yes, my scene is safe. I do not need additional resources because I have fire, PD, and my partners. And I only have one patient. As I approach, what do I see?
As you approach, you see a 40-year-old male lying on the ground on his left side. A firefighter is holding C-spine, and the patient is spitting up blood.
Perfect. Did anybody see what happened?
Bystanders state that the patient was going approximately 50 miles per hour in a 40-mile-an-hour zone. He lost control and laid his motorcycle down. Bystanders say that he hit his head hard and was initially unconscious.
Okay, does anybody know him to know any medical history or anything?
Nobody knows him.
Okay, as I approach, I'm going to direct fire to continue holding C-spine. I am going to immediately just see if I see any other major bleeding anywhere.
You see no other major bleeding?
Okay.
Other than the bleeding coming from his left ear.
Okay. I will note the bleeding from his left ear. I am going to check his airways. I'm going to just see if he responds to me when I come up and kind of touch him and introduce myself.
Your patient moans to pain and loud voices and is groaning.
So he is responsive to verbal, painful stimuli. And he is taking care of his own airway currently by spitting out that blood. I will just make sure that we have suction nearby in case he is no longer able to maintain that. I am going to put my hand on his chest just to see what my rate and depth of breathing is.
You note that the patient is breathing at about a rate of 18, and with your hand on his chest, you can feel some crepitus on that left side.
Okay. I am going to have fire go and grab our backboard. As I continue with my assessment, I'm going to choose my partner to try and get me a set of vitals. And he's going to check CMS. I'm going to see if I feel anything on his back.
You just note abrasion on the left side of the back.
Okay, I'm going to palpate his abdomen quick.
Abdomen is soft, non-tender.
Okay, I'm going to feel his pelvis.
Pelvis is mush.
Okay, I'm going to also have fire grab me the pelvic binder so we can lay that on the backboard.
Your partner comes back with your set of vitals at 150 over 100, heart rate of 88, respiratory rate of 18, SpO2 of 90%, blood glucose of 100, and CMS is intact in all four extremities.
I'm going to place the patient on a non-rebreather at 15 liters per minute. I'm going to quickly continue just to kind of do a blood sweep, see if I find any more bleeding.
No other bleeding is noted.
Okay, circulation was noted that he has CMS in all four extremities, so circulation and blood check was done. Once we are done with that, we are going to make sure that he has a C-collar on, that fire puts on, make sure it's in a good position, and then we are going to roll him onto the backboard at fire at the head's count, and we're going to roll him 1, 2, 3, down. I am going to have my partner recheck CMS as we secure him to the backboard. And I'm just going to check the areas that were not visible when he was laying on his left side, make sure I don't have any additional bleeding anywhere.
You note no other bleeding. Your partner comes back with CMS still being intact.
Perfect. We are going to then load him into the ambulance. I am going to bring at least one firefighter with me while we go. I am going to make sure that the pelvic binder is in the correct spot before we get him into the ambulance, as we put that on when we rolled him onto the backboard. I am going to have my partner get me a 18 gauge IV in one of his ACs preferably, and then we're going to transport code 3 to a trauma center. I'm going to have fire get me another set of vitals as I am doing a full body sweep. I'm going to check his head. I note that bleeding is still from his left ear. I'm going to just put a bandage over that.
As you palpate his head, you notice a golf ball sized hematoma to the left parietal area. On that palpation, you notice skull depression.
Okay, we're going to place an abdominal pad over that depression so that it's noted and nobody messes with it. I'm going to check his pupils, see if we have any pearl.
Pupils, you note that the right pupil is larger than the left, and fire comes back with your vitals at 170 over 90, heart rate of 135, respiratory rate of 30, SpO2 of 88% on your oxygen.
Okay, I'm then going to quickly just check his pelvis. I'm going to, I know that he has the crepitus on the left side. I'm going to listen to lung sounds now.
You hear clear lung sounds on the right and absent lung sounds on the left.
Okay, I am then going to, I'm then going to decompress his lung as he is now tachycardic and his respiratory rate has changed even with the oxygen. So we are going to needle him in the second intercostal space in the midclavicular line. I am going to also palpate his abdomen.
Abdomen is still soft, non-tender.
Okay, I am going to make sure that the pelvic binder is still again in the correct spot. I am going to check his arms, make sure that I have CMS in all four extremities again. Make sure I don't find any additional bleeding anywhere.
You only note abrasions to the left side.
Okay, I am going to call the hospital and let them know that we are going to have a trauma team activation for a 40s John Doe. Positive loss of consciousness. He is now responsive to verbal. He does have trauma to his pelvis and he has absent lung sounds on his left, as well as a possible head injury just due to the depression in his head and the pupil, and then give them an updated ETA. I am going to continue monitoring his vitals every 5 minutes, reassessing lung sounds as I'm doing that too, just to make sure. Keep checking to see if I have any other bleeding. And then I'm going to make sure that we have fluid going wide open through that IV. I would consider giving him TXA as well, just due to the bleeds. And then when we get there, I would give the full report. I have a 40s John Doe. He has a depression to the skull where the abdominal pad is. He has a blown pupil. We have him secured with a C-collar and backboard. There is nothing found on his spine when we did that. He was needled and he still has absent lung sounds on the left. Pelvic binder is in place as his pelvis was extremely unstable and mushy. And then he just has the abrasions. You have an 18 with fluids going. Any questions?